24 months of life. Babies are considered infants until they are 2 years old. During infancy, the brain and body are growing at a rapid pace. Some of the largest developmental milestones occur during infancy. Infancy milestones are best broken down based on month-to-month development. Motor development develops quickly throughout infancy. Piaget proposed 4 stages of motor development. Infants are in the sensory motor stage. In this stage, infants don't think about what they're doing, they simply follow their instincts. All infants are born with a number of certain innate reflexes to help them survive. Sucking, rooting, and grasping reflexes are some of these. Sucking and rooting reflexes help them to be able to drink their mother's milk or out of a bottle. These reflective activities will last from birth to around 1 month. Infants will then move from these automatic non-volitional movements to more advanced deliberate motor activity. At 1 to 4 months, they will begin to have primary circular reactions. This means they will begin to repeat actions that give them pleasure or desired outcome. They also begin making connections at this stage. Babies might suck on their fists because it brings them comfort. They can realize that seeing a bottle or their mother's breast means they are about to be fed. Babies' predictability of their environment formed the foundation of Erickson's observations that infants at a young age either learn to trust or mistrust their environment. If infants at this stage are cared for, comforted, and their needs are met, they will learn to trust their environment. At around 12 weeks, infants may be capable of pushing themselves up and holding their neck up. Tummy time, which is where a baby is placed on their stomach to strengthen their neck muscles, will help them to be able to do this. It is important to remember that not all babies develop at the same pace. They then might begin rolling over and becoming more mobile at around 4 to 5 months. From birth to 5 months, the only language that infants use is cooing or crying. At this point, infants are not truly trying to communicate, just simply making noises. Attachment is a crucial part of infantile development. Depending on how much love and attention babies receive during infancy will determine their attachment style later on. 0 to 3 months is a pre-attachment phase. At this point, babies are not yet showing preference for a caregiver. They can be passed around a room full of strangers and not cry while being held. During the 4th and 5th month, babies might begin to show a slight preference for a particular caregiver, usually their mother or their father.
Infants' length, weight, and head circumference will be monitored quite frequently throughout infancy. There are average and ideal measurements at different stages of infancy. If an area does not progress, it can be an indication of problems such as malnutrition or digestion problems. When looking at these measurements, we often recognize the percentile scores that are associated with the child's growth. A percentile score is defined as the percentage of scores that fall at or below an infant's personal measurement. These percentile scores are found by looking at the average measurement of other infants. In addition to tracking an infant's physical development through measurements, motor development is a key indication when looking at the stage of infancy versus what motor skills they possess. At about 4 to 5 months, an infant becomes more mobile by rolling over by themselves. At 9 months, the majority of infants develop the skill to crawl, which strengthens them, thus getting ready to be able to push themselves up and walk. In some cases, a 9-month-old will skip the transitional step of crawling and scooting and begin to walk. Infants get ready to walk by supporting themselves on sturdy objects such as a coffee table or chair. Once they get used to holding themselves upright, they will begin to try and step. However, they will probably fall until they get used to the walking motion. For every child, this act can take place at different paces, all depending on their activity and the amount that they are practicing holding themselves up and taking small steps. 6 to 10 months is when infants transition from mainly gross motor behaviors to fine motor behaviors. Fine motor skills include how a baby begins to use their hands and fingers. They begin to use their pointer finger and thumb to pick up smaller objects. These fine motor skills increase due to the strengthening of a child's hand-eye coordination. Hand-eye coordination can be seen when a child can successfully bring a spoon to their mouth by picking up objects or throwing a ball. Around the time their fine motor skills develop, the baby develops physically as well. The infant's skull begins to harden and form during the 6 to 10 month range. This is a pivotal time for skull development. When babies are born, their skull is very soft, so they have chances of forming a flat spot on their head called positional plagiocephaly. In order to correct this, babies will wear helmets. Infants are constantly changing, and physical and motor development plays a big role in their overall growth.
When a baby is 11 months, they begin to walk, but the majority of the babies do not start walking until 13 and a half months. At 11 months, they are learning to take care of themselves by feeding themselves. And at this stage, they are crawling and standing up without assistance. They also begin to say words like mama or dada and start waving bye bye. They also begin to see color well and show their personality traits. And at 11 months, the infant expresses separation anxiety. And at 12 months, the baby is going to their first year checkup. And at this checkup, they get recommended certain vaccines. They begin to have more of a social and emotional change, such as playing peekaboo and repeating sounds and actions to get attention. They are starting to show fear as well. And they begin to have favoritism in people. Their brain has also doubled in size, and they also have cognitive development, such as copying something and looking at an object or a person once it's being called out. And they also start to poke with their index finger. And at 13 months, the toddler should be able to take their first steps. And at this stage, their growth has slowed down compared to the rapid growth of a 12-month-old. And they also are introduced to cow's milk, which is starting to be a regular part of their diet at this time. A 13-month-old will need a good amount of sleep, and the parent should lead the toddler to have a 12 to 14-day sleep schedule with 2 naps. And they also start to turn towards noises, and they start to recognize people at this time. And throughout the baby's months, they should be gaining weight. And so according to the World Health Organization, the average weight of a 14-month-old is 20.7 pounds for girls and 22.3 pounds for boys. And the average height for girls is 30.1 inches and for boys is 30.7 inches. Some of their milestones are them walking and them getting potty trained. And at 14 months, they are teething because of their first molars. And at this time, they continue to have separation anxiety. At this time, they should be introduced to new foods and should be eating around 3 meals a day with 2 snacks. And milk is still important because of the calcium. And playing games such as patty cake, stacking blocks, and any push toys allows them to become more mobile.
Babies that are 15 to 19 months have passed the 1-year mark, but have not quite yet reached the 2nd-year mark. So they are still considered infants. Commonly, doctors and parents set up a 15-month checkup to make sure that everything is progressing normally and healthy with the baby. Their brain and personalities are steady growing, and they are still learning and adapting to their environments. One major part of infants' development is their language. During the 15 to 19 month stage, they have said their first words, which are a part of the holographic speech stage, and are now moving forward to vocabulary spurts. This is where they are saying 2 to 4 words per sentence, such as more milk or pretty horsey. To be specific, research has shown that babies who are 18 months learn 2 to 5 new words per day. By the time they are 2 and out of the infancy stage, their vocabulary will consist of more than 300 words. It is very careful that around this age, and that the older the child gets, the parents watch what is said, therefore the baby does not repeat it. Intellectual development of 15 to 19-month-old infants fall into the sensory-motor stage. This means there is no motion of objective reality and have motoric intelligence. The babies are stumbling into experiences. They interact with people and objects in order to get a feel for the environment they are in. As far as physical development, a 15 to 19-month-old baby can weigh anywhere between 22.2 pounds to 26 pounds. Most have already learned to crawl and are good at walking. Some are even running at this stage. Since being so close to the beginning of the terrible twos, they'll begin to explore and getting to everything. Negative aspects of this age group is that they have tantrums, separation anxiety, and love to throw things. Their muscle strength and motor skills are steady increasing. One exciting milestone for parents is that their baby begins to grow their first molars, better known as teething. Last but not least, they'll be able to hold cups, spoons, forks, all by themselves. They'll begin to become independent from the mother or dad. Even though there's no official nutrition guideline for the 15 to 18 months, doctors say that the baby needs approximately 1,000 calories per day, give or take, or about 40 calories per each inch of their height. All of this information was information on the 15 to 19-month-old group, a part of the Infancy.
Infants around 20 to 24 months are much more developed and skilled. Their vocabulary expands to about 100 words, so their sentences are much more complex and simple. Their gross motor skills, which are their large muscles, which are like legs, arms, the trunk of their body, and their neck, these skills help them squat during playing, throw a ball, catch a ball maybe, walk up and down the steps, and even jumping with galloping motions. Their fine motor skills, which are their small muscles like hands and fingers, these skills help them turn pages in a book or even scribble, making lines or shapes or something. And they also know how to build towers with like blocks or something. Their self-help skills, which are skills that help them be independent, such as feeding themselves with spoons or forks, or sucking through a straw, or undressing themselves. Conjugative skills are their mental skills, like learning, thinking, and problem solving. So they know how to share, they know how to take turns, they know how to put things in and out, they know how to name 6 body parts, they know their shapes and their colors. Their dental development, which is their teeth, of course, they gain about 20 of their baby teeth, and they get their molars at about 24 months, so it's like later on in the stage. Their diets and foods, they eat like cereal, bread, fruits and vegetables, and maybe even pasta. And they also become potty trained. They learn how to use the restroom. Sometimes kids may even be potty trained at this point, but most of the time this is when you start teaching your child how to become potty trained. So this is pretty much the breakdown of 20 to 24 months in infancy stage.